Charlie, 712 right now. Multnomah County, Oregon's most populated county, saw its first positive case of the coronavirus this week. The patient now at the VA hospital in Portland. Kim Taves is here with us this morning, the director of communicable disease for Multnomah County. Thanks for coming in.
You're welcome.
So we wanted to check in with you in light of this new case. Is there anything else that we've learned about this patient? What can you tell us about the situation right now?
It's sometimes hard for people to understand why we protect people's confidentiality to the degree that we do, but I think they would understand if it was them that had the case of infection. So it's a male. He was tested and hospitalized at the VA. We don't have new information to share at this time. Our public health nurses have definitely done the case investigation, and they notify anyone who may have been a close contact. Make sure that they isolate until they know if they have symptoms or not, and that they could access health care if they do get sick.
Yeah, and was there any preliminary information in this case that's been, showing how exactly he got coronavirus?
That's the important question, because I think that leads to some of the decisions that we've been making this week about something we call social distancing.
Right.
Most of the cases in Oregon right now that have been across multiple counties don't have a link to a different case that we know about. They don't have a link to recent travel to a different affected country. They're just standing out there alone epidemiologically, and what that means that there are other cases that must have been connected to them that we don't know about. In part, that's just because the testing we have has been rather limited. So when we see that, then we know that there has been what we call community spread of infection, which means it's been local and it's been recent. It didn't occur in a different country and then come here. And that's why we need to enact some of the measures that Governor Brown announced last night about canceling mass gatherings and asking people to think about work differently, what we call social distancing, spreading out a few feet. Luckily, the virus doesn't float through the air in the same way that measles or some other viruses do. It's really within close contact, so if we can give each other a little space from each other, then hopefully we can really slow down the spread.
Right, that's why all that hand washing too that we've been talking about is so important. How is Multnomah County going to be working here with the state in light of this new large group ban? Is there anything that you guys are going to be trying to enforce at the county level?
So we've been working extensively with all the different parts of the Oregon Health Authority, as well as the Governor's Office, the Office of Emergency Management. We work together to coordinate the case investigations. We work together to make sure that hospitals have the supplies that they need from emergency stockpiles. We'll be working together with a mass gathering, not only with the state, but with our neighboring counties, since our metro area really is one cohesive set of healthcare systems and large employers. We need to really work with our business partners. We need to work with our small business partners and our nonprofit organizations as well. I know that impacts of social distancing in the workplace, impacts not only of the sports games folks want to enjoy, but also impacts to fundraisers for social service agencies. There's all sorts of different ways that folks can be impacted, and we'll try the best that we can to mitigate those impacts while we help protect the public's health.
Oh, sure. We've got a long list of events just this morning that we're monitoring and following up on. Real quickly here, before we run out of time, I just want to check in on things like hospital supplies, like available testing. There's been some concern at the national level that we're running out of that stuff or that it's not readily available. Are we seeing any issues with that here?
We've just recently finally started to come on board with commercial testing, which means that the laboratories that normal healthcare systems use for normal tests for diabetes or any other kinds of tests can run through that normal process. That should speed up quite a bit our ability to expand capacity. And the other thing that's changed in the last day is that some of the information about what kind of protective equipment healthcare providers need to wear to do that test has changed with new information that we have about how the virus is spread to make it a little bit easier for that testing to happen in like regular outpatient primary care settings. So hopefully over the next week or so, we should see a real increase in the volume of testing that healthcare is able to provide.
And we're still wanting people to call their doctor before they just walk into a clinic if they think they might need this test, right?
Right, and I know that folks are concerned and they feel like even if they only have mild symptoms, it might be helpful to get tested, but the fact of the matter is it would be more helpful for them to stay home and not go out. People should seek care if they get seriously ill, and they should call first. But if they're mildly sick, we would rather have them not overwhelm the healthcare system, even if it means we may not get their number counted.
A good takeaway.
Yeah.
Kim, thank you. We appreciate it. Stay with KOIN 6 as we continue to bring you the latest on the coronavirus outbreak, and visit KOIN.com. There we have a dedicated section on coronavirus and the current spread, everything we know about what's happening here in Oregon and Washington so far, constant updates on the cases. You can find all of the information from health experts we have on all of our shows at KOIN.com/coronavirus. Now, Jenny, I'll send it back over to you.
Yeah, some good information. Thanks, Emily.